Prime Minister today delivering some hard truths. What was once far away now feels very close.
I fully understand public concern, your concern about the global spread of the virus, and it is highly likely that we will see a growing number of UK cases.
A disease that could soon be spreading freely across the UK. Boris Johnson, together with his chief medical officer and scientific advisor, keen to prevent public panic.
Let me be absolutely clear that for the overwhelming majority of people who contract the virus, this will be a mild disease from which they will speedily and fully recover.
But a responsible government must prepare for the worst, with the NHS and public safety in sharp focus. Yesterday, the Scottish Chief Medical Officer said that up to 4% of the population might have to be hospitalised. Do you accept that figure? And if so, how will the NHS cope with nearly 3 million people being hospitalised? Will you draft in the army if necessary? And can you promise citizens that in the midst of all this, you can keep them safe?
On the NHS and the potential pressure on the NHS, it will be very important for everybody to think not only what we can do to prevent the spread of the virus individually, but also what we can do to avoid too much pressure on the NHS. So when it comes to using services such as GPs or 111, and it will be quite important to be self-restraining where possible, because as I say, most people will unquestionably get through it. And on your second point, the army is of course always ready to backfill as and when, but that is under the reasonable worst case scenario.
Boris Johnson's opponents clear where the priorities should lie.
The NHS needs support in order to cope with what could become a very, very serious problem throughout our health service.
But not just the NHS under strain. This outbreak could strain all of our public services. The government's not sugarcoating the risks in this action plan released today. All of us are vulnerable to catching the disease. 1 in 5 of us could be off work, sick at its peak. The army could be deployed to help police the streets, and all non-urgent NHS care could be cancelled. In the coming weeks, we might be asked to work from home, avoid big public gatherings, stay away from the elderly. But the message from the government today is let's all take this one step at a time. The Health Secretary taking that message to the Commons.
If necessary, we will take some of the actions set out in today's plan to reduce the impact of absentees and to lessen the impact on our economy and supply chains. We prepare for the worst and work for the best.
The worst case scenario contained in here, for now just words on a page. A severe, prolonged pandemic is some way off, if it comes at all. For now, then, business as usual for all of us. But the question is, for how long? Beth Rigby, Sky News, Westminster.